inquiry is in the name of Deputy Dara Calleary to discuss the provision of GP services in Bangor Erris, County Mayo. Deputy, it's 4 minutes for initial statement.
Thank you, Cathaoirleach, and I thank the County Coroner and the staff for allowing me to raise this issue this evening. Minister, you are probably familiar, being a Galway man, with Kiltane and with Bangor, which is at the centre of the parish. And there has been an excellent GP serving that community for some years now. Superb staff giving a very good service. It was difficult to get him when the vacancy came up a few years ago. But he has worked hard and built a very good confidence with the community and providing a good service. We understand from the HSE that he has been offered another position within the West of Ireland and is intending, as of now, to take that up. And as you can imagine, the community are very concerned that their community will be left without GP services. And there is an information deficit in terms of what may happen at the end of February when he is due to take up the position. However, this raises the wider issue, and I acknowledge that Dr. Harty is here with us, of rural GP service. And notice you didn't get to make it out to the GP's protest yesterday, but you would have heard the frustrations of GPs, old and young, in relation to their resourcing. But it's a broader issue, Minister, and I raised this during Rural Affairs PQs with Minister Ring a few weeks ago. It is not right that that department is giving everything to try and maintain services. You have to step up to the mark here as well. So I think the time has come, Minister, and let's use Bangor as maybe a case study or as a pilot study, that the HSE will step in and provide surgeries and provide the facilities in the same way that the IDA provide advanced factories, that the HSE will provide, through public service obligation, a subsidy towards the employment and retention of staff. Because these communities aren't as big as we would wish them to do. One of the reasons they're not as big is because of the diminishment of services. But while we can provide that support in terms of premises, in terms of a subsidy towards the running costs of practice, given that it's in a rural area, I think then you will get and retain GP services in communities like this. You will get people willing to apply for the service. And I'm asking you to actually use this situation now as a potential case study, to engage with the HSE officials in Mayo who are trying their best to try and resolve this issue, and to give certainty to the people of Bangor and the people of Kiltane about the long-term provision of GP services in that very proud community, a community that needs this service. And I think, Minister, that for a very small investment, you will find that we will maybe come up with a model that might help resolve some of our issues about providing GP services across the country. And I want you to go back to your Tuam roots, go back to your Galway roots, and actually champion this at government, work with various government departments, and let's try and do this and keep the current doctor in Kiltane, in Bangor, and allow him to provide the kind of service that he wants to provide to a community who trusts him greatly.
Well, I want to thank Deputy Dara Calleary for raising this very important issue, and I can assure him that I always go back to my Tuam roots and my Galway roots. But can I also, at the outset, I'd like to assure the House that the Government is committed to enhancing primary care services, including GP services. This is central to the Government's objective to deliver high-quality, integrated, cost-effective health service. Our goal is to ensure that patients throughout the country continue to have access to GP services and that general practice is sustainable in all areas into the future. It is imperative that existing GP services are retained and that the new general practice remains an attractive career option for newly qualified GPs. The number of GPs on the Medical Council's Specialist Register continues to increase, up from 2,270 in 2010 to 3,723 as of the 1st of January 2019. The number of GPs holding GMS contracts has also risen from 2,098 in 2008 to almost 2,500 in 2019. The Government is aware of workforce issues facing general practice, including the influence of demographic factors, and in recent years has implemented a number of measures to improve recruitment and retention in general practice. GP training places have been increased from 120 in 2009 to 202 places in 2019, an increase of almost 70% over this 10-year period. As stated in the programme for government, the intention is to continue to achieve annual increases in the number of training places available. Entry provisions to the GMS scheme have been changed to accommodate more flexible GMS contracts, and the retirement age for GPs has been extended to 72. An enhanced support package for rural practice has been introduced with improved qualifying criteria and increased financial allowance of €20,000 per annum. The Government is also committed to engaging, and this is one of the points you raised, with GP representatives on the development of modernised GP contractual arrangements. A talks process is underway between the Department of Health, the HSE and the IMO. Discussions are ongoing in efforts to bring matters to a conclusion. Agreement on the delivery of a range of service improvements and contractual reforms has the potential to facilitate a substantial increase in the resourcing of general practice on a multi-annual basis. The HSE is fully committed to ensuring GP services continue to be provided to the people in Bangor Erris, County Mayo, an area I know very well. The HSE has also confirmed that it will immediately advertise the GMS panel concerned and will explore all options available to ensure GP services continue to be provided in the future. The current GP will continue to provide services until the end of March. The HSE will ensure locum arrangements are in place following this to ensure that patients continue to have access to a GP service pending the appointment of a GP to take over the panel permanently. Thank you, Carla.
Thank you. I welcome the clarification in relation to Bangor. But Minister, your response is completely removed from the reality on the ground. You speak of increased training places on GP training schemes. For the first time that anyone can remember, there was actually vacancies on training schemes because people don't want to be a GP. It's not the option for so many people anymore. And if they want to be, they certainly don't want to be a new GP in Ireland, because GP practices are no longer viable in many areas, and you would have heard that yesterday. I know there are communication difficulties in the Department of Health, but surely you must have heard the complaints. And you know what? One of the most disheartening things yesterday was, yes, we've met younger doctors, but when you see older doctors who've put their life and soul into building up practices and into building communities, and meeting them yesterday and hearing them more or less broken and not recommending people to follow that path. On the last occasion this contract was advertised, it was difficult to fill it because the supports, you mentioned the rural practice allowance, that is not enough, Minister. You know, we have to look at this differently. By the time you kit out a premises, by the time you staff a premises, 20,000 doesn't go an awful long way on a list which is around 500 people. So you've got to look at this differently, and you're going to have to use this as a pilot to put the facilities and put the services in place for the GP, and to give them an investment, and then you will actually fill the vacancies. There are vacancies in rural Ireland, vacancies cannot be filled, yet you speak about GPs' numbers on the register going up. That's no good to somebody who can't get access to a doctor because there's not one in their community. So I'm asking again for you to work and put a package in place, to use Bangor as a case study, as a pilot, to put the facilities in place and actually work with the existing GP, because you might find he's very happy to stay there. And I can assure you, the community have enormous trust in both him and his staff, and they want to keep him there.
Thank you. Can I say, Deputy, yes, I did hear the GPs yesterday, and I would have regular meetings myself with GPs, so I'm aware of the issues, the genuine issues you raise. But in conclusion, can I say, I'd like to reiterate the Government's commitment to ensure that patients throughout the country continue to have access to quality GP services. The Department of Health, together with the HSE and the Irish College of General Practitioners, are committed to working together to improve the recruitment and retention in general practice over the coming years. On your 2 points about the pilot issue and the case study and working with the GPs, absolutely, I'll put those proposals to Minister Simon Harris as well in relation to that objective. In addition, the goal of the current phase of the GP contract talks is to reform and modernise the existing GMS contract. I think this will be a key in making general practice a more attractive career to young doctors. In relation to GP services and Bangor Erris again, I'd like to reassure the Deputy that the HSE are taking all necessary steps to ensure that a new GP is recruited as soon as possible and that the locum arrangements will be in place to ensure services to this community are retained while the recruitment process is underway. But of course, the other suggestions put forward, I'll bring them to the attention of Minister Simon Harris as well. Thank you, Carla.
Thank you, Minister.